Vice Governor of Hebei, and the Deputy Secretary General, Mr. Yu Wenxue, Director of the Health Commission, Mr. Deng Yunbo, the Vice Head of the Transportation, Mr. Hou Zhimin, and also the Chief of the CDC of Hebei Province, Mr. Shi Jian, and to vote together to answer some of your questions. First of all, please allow me to give the floor to Mr. Xu. Friends from the media, good afternoon. First of all, please allow me to give you the updated information regarding COVID-19 in Hebei Province. From 0 to 10 a.m. on January 19, we had reported 9 locally 5 transmitted cases, including 1 case transferred from the asymptomatic cases, all in the Gaocheng district of Zhijiazhuang. From 0 to 10 a.m. Today, we have 1 newly reported asymptomatic cases in Gaocheng, Shijiazhuang. From January 2nd to 10 a.m. on January 19th, we have accumulated cases, 822 cases, 771 in Shijiazhuang, 50 in Xingtai, 1 in Langfang. Yesterday, 4 confirmed cases have been cured. So far, we have 16 cases cured and discharged from the hospital, 1 death. There are still remain 805 cases, including 754 in Shijiazhuang, 50 in Xingtai, and 1 in Langfang. From January 2nd to 10 a.m. on January 19th, the accumulated reported cases of asymptomatic infections, 371, including 352 in Shijiazhuang, 19 in Xingtai, 181 asymptomatic confirmed to the COVID-19 cases, 171 in Shijiazhuang and 10 in Xingtai. Yesterday, 3 asymptomatic infections actually were freed from the quarantine. And so far, 22 cases freed from medical observation. So far, we still have 168 asymptomatic infections, including 159 in Shijiazhuang and 9 in Xingtai. Now I would like to give you a bigger picture regarding the differentiated, precise containment efforts in different regions. First, from January 16, besides Nangong and Nongyao in Xingtai, the other places in Xingtai actually freed from lockdown. Today, actually, is from January 19th. Besides Guan in Langfang, the rest regions also free from lockdown. Started from January 18th, Nangong, Xinle also identified as a high-risk region. Second, so far, we have 3 high-risk regions, namely Gaocheng, Xinle, and Nangong. 36 middle risk areas, including 34 in Shijiazhuang, 11 counties and districts, 8 in Yuhua, and 5 in Gaoxin district, and 4 in Zhending, and 3 in Xihua, 3 in Qiaoxin, 2 in Luxin, and 2 in Luji County, 1 in Luancheng district, 1 in Pingshan County, one in Xintang County, one in Langfang City. It's the Yingguogong community, and one in Xintai is the Yancao Jiayuan community. The rest regions in the Hebei Province are all low-risk regions. Third, for the regions with different risk levels, we actually have the differentiated containment measures. For the low-risk regions, we strictly implement the regular disease prevention and control work, monitoring the disease prevention and control, screening out, and also to do the following up work. For the middle risk regions, so we also practice the irregular disease prevention and control, and on top of that, we also identified the specific regions which should be based on the ground needs and also limit the public gathering activities. We also emphasize on the screening and the testing work. For the patients or the people showing the symptoms such as fever or coughing, as well as the hospitalized patients and their family members, and also the people that with the worsening underlying diseases, and also the people working in the hospitals should receive nucleic acid tests. For the farmers market, the schools, as well as the kindergarten, daycare, the nursing homes, the prisons, detention centers, we should also access the level of risks regarding COVID-19, and the people included should also receive the NIT. And also at a different compound, we should also take active screening work for the people showing symptoms in the past 14 days, such as the fever, coughing, diarrhea, and we should bring them to the designated testing places for test as well as treatment. Based on the ground need as well as the assessment results, we identify the priority of the target group to receive NAT. All these matters should have counted 14 days after the latest case confirmed. Regarding the disinfection matters, for the confirmed cases, the community buildings, their working places, as well as the possibly contained transport vehicles, the public areas. So we conduct the weekend disinfection work for the places as well as items. For the high-risk areas, on top of all the measures for the medium risk level places, we also conduct the following additional measures. First, based on the result of epidemiological investigation, we organize the risk assessment work to identify the risk community and as well as the buildings. Second, we also carried out the screening work, so door-to-door, household-to-household. If we found the people showing the symptoms such as coughing, fatigue, fever, or diarrhea, we will bring them to the designated places for NAT and treatment. Third, we also limit the public gathering activities. We put a stop temporarily to the cinemas, the theaters, the performance places. And fourth, for the measures, we also take on the lockdown measures to the schools and also to the working places, and also limit the people going in and out to certain places. if the places with no newly confirmed cases after the last case is cleared off for 14 days, then that places can be freed from high-risk measures. The stay-at-home measures in Shijiazhuang will be ended midnight today. And we will also organize a new round of citywide NAT and will be finished expectedly in 3 days. And during these 3-day citywide NAT, we'll continue the stay-at-home measures. We will also organize the experts to study and discuss the situation and to lay out the differentiated, precise disease prevention and control plans in order to avoid the revisit of the virus. For the different departments, we will carry out the NAT work as well as stay-at-home measures and also prepared for all these measures implementation. Especially during the NAT, the daily necessities, the screening out work, actively monitoring the limitation of a public gathering, the lockdown measures to certain places. The detailed plans should be carried out and also practical, and everyone should know their role and responsibilities. Make sure each post, each link, we have a contact person. Here, I also would like to call on all the residents here in Shijiazhuang to give us the continuous support and please be cooperative. Thank you. Thank you, Mr. Xu. Now the floor is open. Please identify your media affiliation before raising the question. With People's Daily. So talk about till the 24 a.m. today. That will be the decision whether it would like to extend the stay-at-home quarantine in Shijiazhuang, and also would like to know more details about the third round of NAT. Thank you for your question. To 24 a.m. on January 19th in Shijiazhuang and Nangong actually will be the last minute for the stay-at-home for the whole city. This actually is the measures carried out after the result we got for the second round of NAT, because we still found the newly confirmed cases. So we studied the situation and also showing that we still have the risk of further spreading of the virus. So we need to find all these potential risks out. Therefore, the decision is that for Shijiazhuang and Xingtai, started from January 20th, we will continue our NAT for the third time. Within 3 days, we will finish a city-wide NAT, while the stay-at-home measures should be practiced. And for Langfang, the stay-at-home measures will be continued until January 25th. And they will also receive another round of NAT. And within 3 days, it should be finished, as well as the stay-at-home should be also practiced. For Longyao, from January 17th, they started this lockdown. And on January 18th, they had this first round of NAT. After 14 days, they will receive another round of NAT. Going forward, based on the result of the new round of NAT, based on the requirement of the 7th edition of the Disease Prevention and Control Protocol, we will lay out a precise and differentiated plan. For the low-risk regions, they will free from lockdown in a well-orderly manner and resume the work and daily life. And we will also put a close eye on the disease prevention and control at the rural areas, make sure that these infections carried out to the environment as well as the items. We will use different ways to carry out the irregular disease prevention and control measures. I also would like to call on everyone to keep your hand hygiene, let the fresh air coming in, and also keep social distancing. For the mid and high risk regions, and we will follow the standards and the requirements, and we will also identify all these regions dynamically. Thank you. With Hebei TV. As you just mentioned, going forward, we will continue the differentiated practice by different regions. So why we come up to this conclusion, and for the execution, how we make sure that the measures actually are precise. Based on the arduous work and cooperation among the different departments, we can see right now we contain the further spread of the virus. So based on these preliminary results, we still find there are still some uncertainties and instabilities. The experts from the national and provincial level studied the exact facts here in Hebei. And we also actually look into the details of the differentiated plan for the different regions. And we also dynamically identify all these places, make sure that our measures are right for different places. For the places with the suspected cases or the confirmed cases, we conducted right away the epidemiological investigation in order to lock the close contacts and the secondary contacts at an early date and bring them to the quarantine places, make sure that the disease will not spread to other places. For Shijiazhuang, Xingtai, and Langfang, we practice the lock-off, make sure that the no virus spreading outside these three places. And we also give the notice to the neighboring cities, right now just Xinjiang, Zhejiang, and Shanxi, with the sporadic cases linked to the cases here in Hebei. We also found that 80% of the cases actually locked and found in Gaocheng. And Zhengchunde actually is the ground zero in Gaocheng. And they also showed the links from the epidemiological perspective. Therefore, for these ground zero places, we practice the different level of the measures, and that including the NAT as well as the screening work. For the key regions inside the mid and high risk levels, we will actually carry out more rounds of NAT to find out the potential confirmed cases. And we will also identify the risk levels in real time, and we will also make the timely decision on the risk practice. Xinhua News Agency. We quite focus on the work going on for the building of the quarantine places. Would you please talk more about the updates? Thank you for your question. Let me give you some updates regarding this building newly built places. Based on the COVID-19 requirement, the government decides to build the quarantine places. We established the working group with the vice deputy and vice mayor as the top head. We dispatched the work forces and also start the whole construction work from 14th with the 6 days hard work, days and nights. Today, we'll have 606 rooms with corresponding equipment will be delivered in 2 batches. And tomorrow we will also have around 173 rooms available. So in total, we have around 1,900 rooms available. This is at the southern part of Huangzhong village. Actually, this is existing construction places. 658 mu actually was the building areas. So the total room number is 4,156. So the total areas is around the 115,000 square meters. So the construction actually followed the infectious disease requirement. So 1 room per person, and we also have the 2 passageways and also the 3 areas for the containment and the clean needs, and also have the disinfectant places, and also for each room is around the 18 square meters, and also have the septic tank. That's a separate one, and also have Wi-Fi, TV, as well as air condition. And the second, we have 11 quarantine places within this compound, and also 1 centers, 6 camps for the working staff. So 628 people actually can be accompanied here. So this follows the strict requirement of disease prevention and control of COVID-19. And third, we also have specific places for emergency uses. And this place actually can be transferred to the school dormitories or the dormitory for the companies or the commercial houses. The construction companies race against time. The suppliers, the transport companies involved also give the great support, as well as the help from the transport department, and also receive donation from the people across the society. And this is a tremendous power gathered by everyone contribute their job. And we have seen the many touching stories happened. Because of these people working on the front lines, they created these many miracles. Going forward, we will for sure the safety of constructions, as well as meet the standards of the COVID-19 prevention and control. We will do everything we can to speed up the construction, make sure that we can deliver all the rooms at an early date. Thank you. Hebei Daily. Some lockdown practice in certain places actually brings some of the hurdles to the transportation. I found some of the truck drivers actually stopped and stuck at the halfway of their journey. So how we can deal with this situation? From January 6, Shijiazhuang and Xintai practice the temporary transport limitation. If not transport for the anti-epidemic materials, they cannot get the pass, and they also not with the available valid NAT, so they were not allowed to enter to Shijiazhuang and Xintai. So we could see some of the drivers actually stuck in their journey back home. So we found this situation and also have specific medics to give the NAT to these drivers. As of this morning, 10 a.m., 4,266 drivers finished their NAT with all negative results. right now they already started their journey. Because this is a dynamic situation, right now we still have around 96 drivers still at the service station. 79 people already had their NAT taken. For these people, actually at the service zone, and we provided the certain help to them, make sure their basic needs were met. So far, they were in a quite good order. With the help of the transport department, we conduct the A3 works. So we have the 1,266 trucks on call. 1,110 trucks actually transport the anti-epidemic personnel and materials. 2,283 trucks and also the A105 cold chain trucks are also in service. We have 130 times of emergency vehicles performing their work. 1,393.5 tons of the materials transport. We also established the 3 transfer stations and also issued the notice to the public, make sure the emergency materials could be transferred at these stations. On January 8th, we also issued a notice regarding the safeguarding the commute for the medics. So we have specific routes of the buses, the 73 for the medics. So far, 262 buses performed the job to carry the 736 medics. So far, 2,250 buses are in service to bring the medics to their working places or back home. We also have taxis on call as well. Third, regarding the reduction of transport. So after the lockdown is lifted, for the Shijiazhuang, Xingtai, and the Langfang, these 3 places, actually we have the plan to resume the transportation when the lockdown measures are lifted. For the buses, taxis, and other places, right now already in a good, smooth manner. For Langfang, from January 19th, we also bring back the urban transportation and also tax services. So far, 38 bus routes available with 581 buses available. Thank you. It's China News Agency. We noticed that besides Gaocheng, Longyao, and also found that some other places where sporadic cases happened. So people are quite concerned about these sporadic cases. So based on the epidemiological investigations, whether these cases are actually linked with the previous cases, and also do we know the transmission route as well as the origin of the transmission, and also have the question regarding the precise disease prevention and control. What the plans do we have? Thank you for your question. For Longyao, we actually received the information regarding the confirmed cases found there, and we initiated our investigations. So we look at these people-to-people transmission. We look at actually the family members who work and live in Shijiazhuang, and also visit their hometown January 3rd, and also they confirmed the cases from January 2nd and 3rd actually involved in the preparation of a wedding ceremony. So it's also the possibility that the person in contact with the confirmed cases during that 2 days. Right now we also screen out the possibilities. And the another way we think about this actually is also the transmitted by the atoms. The confirmed cases actually are the sanitation workers. They work actually is also clean the waste. So it's also maybe possible that they were infected by these contained items. And we also look at the genome sequencing, and they are quite highly identical with the genome we found in Shijiazhuang. So that also showed that the potential link with the case in Shijiazhuang. So far, the work is still undergoing. For Longyao, we have conducted the following works. After we found and confirmed the cases, Longyao initiated a third round of citywide NAT yesterday morning. Make sure the quality is guaranteed. 616 stations with 1190 medics involved. And we also give additional trainings to the medics, make sure that the result is guaranteed. And the quarantine work as well as epidemiological investigations are going on. For the close contacts, all these close contacts right now also quarantined under medical observation. And for Longyao, that exact community right now is upgraded to the immediate level risk places. The whole region right now is locked down. Fourth, we also carried out the disinfections. For the confirmed compound, their working places, we conduct the third round of the disinfection work. So based on our interviews at the front lines, we noticed that the top medics actually dispatched to treat the patient here in Hebei. Would you please talk more in this regard? Thank you for your question. Since the outbreak of the COVID-19 happened this time in the Hebei Province, the National Health Commission had great importance to the patient treatment. And we also received the support from the National Health Commission, and also the top medics also dispatched to give the guidance on site here in Hebei. The Beijing Union Hospital, Chaoyang Hospital, Xuanwu Hospital, and Huaxi Hospital, they had a rich experience in the patient treatment in Wuhan. So they also participated this time to save lives of the critical and severe cases, and also received the support from the other provinces, and also give a focus on treating the critical cases. Talking about the TCM, the Zhang Boli, academician Zhang Boli also visit the places and also discuss with the practice and also look into the cases and look at the cases here in Hebei, whether it's the same as they met before in Wuhan, and also to make the judgment of the right now TCM decoctions. Right now we have 29 severe patients, 17 in the chest hospital and 9 in Shijiazhuang, 3 in Xingtai Second Hospital. For the chest hospital, 2 cases with ECMO. Right now, the experts and the whole team intensify their efforts to treat the patients. And the national CDC and also from Beijing and Guangzhou, Shenzhen, in total 173 people give us support in NAT, make sure that NAT work will be finished as planned and also quality is guaranteed. And Tianjin give us a national team and also with the 60 negative pressure ambulance. Hubei also give us the Fangcang CT equipment. So that is good for us to transfer the confirmed cases or the patients as well as the empty the bed capacity, and also received a phone call from the other provinces saying that they are ready and waiting for the call to give us support. And also would like to take this opportunity to say a big thank you to all the neighboring and brother cities and provinces. And now 1,226 medics from different cities give us support and also do the work here in Hebei. We will look at the course development of the patients. We may see more cases of the patients in severe critical conditions. So with the guidance given by the national and provincial experts, we will establish a dedicated expert team with a tailor-made treatment plan, make sure one patient actually with one specific team and a personalized treatment, make sure we'll do everything to save their life and lower the mortality rate. With CGTN, we have noticed that the number of confirmed cases actually is declining. Can we say that we basically contained the efforts, and whether we still have some difficulties in terms of the epidemiological investigation? We received the first report of confirmed cases on January 2nd, and we see the curve is going rapidly up and reached the peak on 6. We received more than 100 reported confirmed cases, and from 7th to 9th, we see the curve flattened. And to the 17th and 18th, we see the declining of the number of confirmed cases. We see actually this is actually a curve is more flattened, and also because of the practice of strict disease prevention and control measures. First, we locked the ground zero places to make sure that we stem the spread of the virus, and also for the different places, we also practice the precise differentiated containment efforts, and we also conduct the citywide NAT as well as epidemiological investigation, provide the science-based evidence for further plan made. Right now, we have seen a very clear declining of confirmed cases, but based on the nature of infectious disease, as well as COVID-19, we will also expect to see some new cases reported. Right now, we're still in a critical time. We should not slacken off our efforts, and we also look forward to see that tipping point happen at an early date. After the outbreak of the COVID-19 here in Hebei, we conducted our epidemiological investigation, and based on the laboratory results, we turned every stone and also found the patient zero. We have got some results and also got some clues. But some clues we should also look into details. That also is time required, and we'll work with the expert team from the National CDC as well as the Public Security Department. We will provide the technical support from a scientific base. Due to the interest of time, one last question, please. CGTN Daily. People quite keen to know about the vaccination. Would you please talk about the storage of the vaccines and also the plans for vaccination? Thank you for your question. Regarding vaccination, this is an effective way for our containment efforts, and also with great significance. Based on the requirements of the Interagency Task Force, we also carried out the emergency use of vaccines. And we also started this vaccination from the mid of December last year. And right now, for the high-risk group, people for the city operations, right now they are the top priority to receive vaccines. For example, the people working for the cold chain, the importation, the people for transportation, and medics. At the same time, based on the ground needs, Shijiazhuang, Xingtai, and Langfang, these key areas, the medics, the people guarantee the normal city operation. For example, the courier boys and the community workers, they are the top group to receive the vaccines. On top of that, we will also carry out the vaccinations to the other peoples and make sure that the vaccination can be carried out in a well-orderly manner. So we have the standards and requirement in place to establish the vaccination stations, and also people receive the trainings, and also we also have the practice required for the vaccination. For example, we have the medics on site to see whether the people after vaccination show any side effects. Right now we have more than 1,000 agencies to give the vaccinations. For people need to conduct overseas trips, for each county, we need to have at least one agency to give vaccination to the people and need to conduct overseas trips. So we also have these information available to the public. So far, for the vaccines, around 3.9 million. Around 1 million received here. For the key groups, 386,000 people received their first shot. Around 400,000 people received their second shot. So our top priority goes to the high-risk group of people, and then we will roll out to the other group of people. Thank you for the friend from the media, and also thank you for all the speakers. And this is the end of today's presser. Thank you all.